Maybe if we weren't
Hi, Doktora. Morning po.
Hello, good morning, Doc Friends. Good morning, everyone. Good morning sa ating mga nanonood sa portal. We are live via the Top Notch portal. Hello, hello sa aking mga BBs. Okay, hindi pala ako nakikita. Ayan. Okay, good. Narinig niyo ba ako? Narinig ba ako, Doc Friends?
Rinig,
Alright.
rinig.
So yes, correct. Parang galing nasa ospital pa si Doc Friends. From duty ka ba?
Hindi, papasok. Mag-duty pa lang ako today.
Mag-duty pa lang siya today. So, hindi na natin to. So, what we're gonna do today is, this morning, all right, is we're gonna read the questions first. You answer sa inyong mga scansion sheet, no? Yung inyong quiz scansion sheet. And then after, okay, we discuss ni Doc Prince. No need to read the questions again, Doc Prince. We will just give them a few seconds, mga 10 seconds to answer the poll.
Okay.
All right.
Alright.
For now, mag-aano muna sila. Okay lang magsasagot muna sila ng mga tanong. All right.
Sige.
So our quizmaster for this morning to discuss internal medicine, we have Dr. Prince Moisi Rubio, November 2020 PLE, cum laude, top 5 of the University of the Philippines, College of Medicine. Currently an internal medicine resident in training at St. Luke's Medical Center. All right, so guys, ito ang mga questions natin. I will give you 30 seconds, 30 to 45 seconds each question to answer sa inyong mga scansion sheet. Okay?
Good morning, Ninya. Good morning, friends.
Morning, Broly. Bye. Kumusta?
Pause mo muna, Ninya. Pause mo muna. Magbibigay lang ako ng So again, you're already in your internal medicine for the mastery period. What we recommend is that you stop OB for now, okay, and then move na to internal medicine for the next 2 days. For internal medicine, you will really have to use the main handout. It's a compilation of guidelines, clinical practice guidelines, Harrison's, etc. Okay, friends, try to keep it within 30 minutes, the discussion. Okay, explain as best you can based on your
That's also the goal.
IM experience. Okay, so yun lang, galingan nyo guys. Some of you are, Doc, napapagod na po ako, or Doc, hindi ako catch up. Talk to your mother goose, talk to your mentor, get a mentor, or message me on Facebook Messenger, pag-usapan natin. It's basically what you need is academic counseling. Pag ganyan, paano makahabol, ano yung tactics. It will vary depending on your context, yung recommendations and advice. Thank you so much, Nina. Thank you so much, everyone. Back to you.
Thank you so much, Doc Broly. All right, so this will be our Quizmaster session. Wait lang, guys. Setting it up. Okay. You have to read the question and answer sa inyong mga scansion sheet. So this is question number 1. Second question. Third question. Question number 4. Question number 5. Question number 6. All right. Question number 7. Question number 8. Question 9. Okay. Next question, last, neurology and psychiatry. Okay, those are our questions, no? Sinagutan ko rin kaya medyo matagal. Iniisip-isip ko din kung ano ang sagot. All right. So mamaya sasabihin ko sa inyo yung score ko, yung hindi nag-aral na score. Okay? So everybody, please welcome to the virtual floor Dr. Prince Rubio for your Quizmaster session in internal medicine. Prince, you have the floor.
Hi, Doc. Pa-share lang po ng nung sa screen
Yes.
share.
Ay, hindi ka ba makashare? Wait lang.
Enable lang po.
You have access na, Doc. Pa-check na lang ako if you can share.
Yan. Thank you, Doktora. Share my screen now.
Yan, perfect.
Okay. So guys, good morning. Once again, I'm Dr. Rubio. So today, I'm going to discuss my questions for the IM Quizmaster 2. Okay, so in my exam, i-make sure na na-cover lahat ng ating topics na pwede lumabas sa exam. Okay, so we'll start now with gastroenterology. So again, for that, this is my main reference, of course, the Harrison's 21st edition. Okay, dyan lang lahat ng galing ng mga tanong. Okay? So gastroenterology. So we're talking about here alcohol-associated liver disease. So the correct answer should be letter
Wait lang,
A.
Doc Prince. Magpo-poll
Alright.
lang
Ano ba
muna
dapat ang
sila.
sagot dyan? Yes po.
Doc Prince,
Okay,
magpo-poll.
simple po sila. Kala ko yun na. Sorry,
And then
sorry.
please announce the
Alright.
result of the poll, Doc Prince, para makita nila kung
Okay.
paano nag-iisip yung mga ibang student.
Sige, sige. So for naman, Doktora, the answer of the students is letter A then as well. ALT to ACF ratio is more than 1. So normal lang dito ang ating serum bilirubin and INR and expected na mataas ang ating GGT. So let's discuss the case kung bakit. So your alcohol-associated liver diseases is actually a clinical spectrum. Pag spectrum siya, meron siyang entity from one end going to the other end. So yung pinaka-benign niya is actually your alcohol-associated fatty liver disease. Now, next at the middle is your steatohepatitis. And of course, yung pinaka-toxic, yung pinaka-nakakatakot is your liver cirrhosis. And eventually, there's going to be a nidus for your hepatocellular carcinoma. Now, in ALD, always think of AST should be at least more than 1. Pag tumaas ang AST ng isang point lang, then your ALT, automatically you have to rule out your alcoholic liver disease. Doc, bakit? Kasi it's a very strong risk factor for your hepatocellular carcinoma and cirrhosis. So kailangan mo siyang makuha agad at makatch agad. So my mnemonic here is of course toast. Think of a group of people having a toast. AST. So dapat mataas ang AST mo para magkaroon ka ng ruling out for alcoholic associated liver disease. Now, bilirubin and INR can be normal or elevated depending on the case. And GGT is usually elevated. But your gamma glutamyltransferase is actually associated with elevation of your enzymes, ALD, pero hindi siya laging mataas. So, hindi siya ginagamit na marker. So, pwede lang siyang ancillary diagnostic. But what you should know here is when to investigate for the more complication, for the further complications of your ALD. And that is, of course, one of them is your steatohepatitis. So, kailangan, pag tumaas ang AST mo siya kay ALT mo, ng medyo kontang sobra, tapos tumaas na din ng iyong INR, this should be INR, guys, sorry. Okay? Ay, sorry. Hindi pala INR yan. 1.5 talaga siya, sorry. So, pag ang AST, ALT mo is more than 1.5 already, yung kanyang ratio, medyo mo suspect na ng konti na baka may hepatitis ka. At the same time, kapag naging jaundice ang pasyente mo, and as we all know, you will have jaundice if you have bilirubin levels of more than 3 mg per deciliter. So you have to investigate for alcoholic hepatitis. Now, kapag ang nangyari naman ngayon ay pumalya na ang yung INR at bumaba na ang yung albumin, kakabangan na ng konti kasi baka meron kang cirrhosis. Remember guys, your PTINR and your albumin are the markers for the synthetic function of the liver. Kaya you have to test them when there are problems of the liver. Kasi pag buwaba ng ang iyong albumin, it means hindi na nakakagawa ng albumin ang iyong liver. Kasi namamatay na yung mga cells niya, napapalitan na ng mga fibrotic material. And kapag tumaas ang INR mo, sabihin ay pumapalya na ang iyong coagulation. Meron kang problem in synthesis of the liver, therefore, you have cirrhosis. Always remember, guys, having a problem in the synthetic function of the liver could be related to liver cirrhosis. Okay? And please, don't forget that.
Okay. Friends, modulate your rhythm. Dito sa lecture, masyado kang mabilis.
Ay, sorry, madali ng konti.
Tapos bigyan ko lang ng additional tips yung mga estudyante kasi favorite to din sa exam. Tama yung mga pinipili mong questions. Guys, even in med school, yung AST-ALT ratio, kung saan siya mataas, halimbawa dito, alcohol, AST-ALT. I think sa other liver disease, friends, mas mataas yung ALT compared sa AST, right?
Yes.
So, dito guys, ang mnemonic ko dito, tingnan mo. AST, S there is for San Miguel beer. So that's
Pwede,
the one that
pwede.
you will associate with alcohol. Pag mas mataas yung AST compared doon sa ALT. And please take note, tama yung sinabi ni Friends. Testable topic din to. The synthetic functions ng liver is not actually your AST or ALT. Kasi yun yung common confusion eh. So hindi AST, ALT yung synthetic functions ng liver mo. Liver function test. So it's actually PT, INR, and albumin. Okay? So modulate your rhythm, Friends, and then tell them yung
Sorry.
misconceptions.
Start nang pasok sa umaga.
Common misconceptions for this particular sa mga topics mo and kung ano yung testable. Okay? So,
Okay.
demonstrate ko lang for you. Continue.
Thank you. Now we proceed to the next question. So we have your cardiology. Okay, so let's answer the poll now. Okay, so most of you answered A, second degree AV block, Mobitz type 1. So that is the correct answer. The progression of the lengthening of the PR interval followed by a bit drop. So we have different types of AV block. Okay, so we have 4 types actually. First degree, second degree Mobitz type 1, second degree Mobitz type 2, and your third degree AV block. So for some orientation, this is the P wave here. Maligyan ko lang ng aking pointer. Okay, here's the P wave. This is the QRS complex. Okay, and this is the P wave. Yung space between at the start of the P wave up the start of the QRS wave, that is the PR interval. So we check for that because that is the sign, that is the part na titingnan mo when you're talking about AV blocks. Okay, the P wave kasi represents your atrial contraction and the QRS complex reflects your ventricular contraction. Ang kwento dyan, dapat mauna muna yung P wave before the QRS wave kasi gusto mo muna magpasa ng blood coming from the atrium going to the ventricle para mas mataas ang iyong cardiac output. Recall your Frank-Starling mechanism. Alright? If you have added volume from the atrium going to the ventricle, mas nababanat yung ating ventricle. Therefore, pag nabanat siya, mas malakas yung kanyang force of contraction. Okay? Sipin nyo parang yung rubber band, di ba? Pag binanat po siya ng sobra-sobra, mas malakas yung kanyang contraction pagkatapos. So that is the rationale. You should have a proper feeling of your ventricles. Now in this case, there's a problem here. Yung mga AV block natin, may problema sa ating AV node and its system. Meaning, nagkakaroon ng further delay lalo sa pagpasa ng electrical signals from the atrium, from the SA node going to the ventricles. So with that said, nagkaka-problem ka rin with your ventricular feeling. Okay, so the first type is your first degree AV block. Dito, it's very simple. Kapag yung period interval mo is more than 200 milliseconds or more than 5 small squares, 1, 2, 3, 4, 5, di ba? And it's permanently fixed across all types of beats. Ibig sabihin, it's a first degree AV block. Now, kapag ang problema ay second degree AV block mo beats type 1, pansin niyo guys, okay? As you can see here, ito una, 1, 2, 3, 4, 5, 6 lang siya, yung period interval mo dito. Ito naman, 1, 2, 3, 4, 5, 6, 7, 8, 9. Tumataas siya. Dahan-dahang lumalayo si PR interval, lumalaki si PR interval, dahan-dahang lumalayo si QRS complex kay P wave. Hanggang bigla siyang nawala. Now guys, unti-unting hindi paparamdam si QRS complex kay P wave. Hanggang nawala na siya ng todo. So therefore guys, QRS complex is not the one for P wave. Okay, so not the one for P wave, it's your type 1 second degree AV block. Now P wave will ask QRS complex, when ke babalik? When ke babalik? Okay, so it's also your when ke back phenomenon. Okay guys, take note of that. Okay, not the one for you, Mobitz type 1, when ke back phenomenon. Pareho lang po sila. Okay, so unti-unting naman
Nawawala yung internet mo, Friends. Ninya, paano nga pasi si Prince dyan?
Doc Friends?
Complex
Doc
from
Friends?
the P wave hanggang bigla siya. No, for ako.
Doc
Sorry,
Friends?
nakadikit ako sa... Yes.
Doc Friends, sorry. Medyo choppy ka. I think it's with your internet connection, Doc Friends. Nawala na si Doc Friends.
Oh,
Ayan, hintayin natin ang pagbabalik. When ka back, kaya babalik si Doc Prince. No? Isa siyang P-Wave. Prince Rubio. Ay, isa kang P-Wave. Yan, now you're back.
hindi ka na lang
When
ako
ka
sure.
back?
Mabagal ang internet ng hospital. Nakaka-stress. Anyway, nakuha niyo ba yung ano ko? Yung sinabi ko about your first one? Nakuha niyo ba?
Yes, okay naman yan, Doc Prince.
Okay. So basta
Okay ka
ang
pa
point
dyan
is
sa mga
ating,
parts na yan.
Mobius type 1 is unti-unting lumalayo si QRS complex kay P-wave hanggang bigla siyang nawala. So therefore, QRS is not the one for P-wave. Okay? So bigla siyang nawala dito. And as you can see guys, unti-unting lumalaki yung PR interval. So sabi ni P-wave kay QRS complex, when ke babalik, when ke back phenomenon. Alright? Now, kaiba naman for our Mobius type 2. It's still second degree, but this time, guys, as you can see, the PR interval is actually practically the same. Hindi siya nagbago at all. Okay? Same size lang siya, 1, 2, 3, 4, 5, 6. 6 pa rin siya. 6 pa rin siya until bigla siyang nawala. Nawala si QRS complex natin. So, it's actually a ghoster. Ghoster si ating QRS complex, bigla siyang nawala. Okay, so ghoster, biglang nawala si QRS complex mo without even going away from P wave. So ghoster siya. So type 2, Mobius yan. So yung mga friends kay P wave, hindi na siya babalik. So huwag mo nang tanongin kung when siya babalik. So therefore, this is not your when back phenomenon. Okay. Next, your type 3 AV block or your third degree AV block. This time, the main pathology is that there's a complete block. So pareho lang po sa ating complete heart block. Therefore, meron kang dissociation ng P-wave sa QRS complex. May sariling mundo si P-wave, may sariling mundo si QRS complex natin. Recall that the P-wave is actually coming from your SA node. So ang SA node mo, may sarili siyang rhythm na ginagawa. While your QRS complex, may sarili din siyang mundo. Therefore, hindi sabay ang kanyang RR interval. Okay? Same lang si QRS complex dito sa kanyang next one. Pero si P-wave ay may sariling mundo na nangyayari. Okay? So that's a complete heart block. Okay, next question. Okay, Totga versus Ghoster. Again, guys, Mobius type 1, not the one for you. Ghoster, Mobius type 2. Okay, next question. So guys, may now answer the poll. Okay, choose the best answer here. What are the components of your tumor lysis syndrome? Okay, so most of you answered letter D, and that is the correct answer. Okay, the components are your hyperuricemia, hyperkalemia, and your hypocalcemia. So what happens in tumor lysis syndrome? So nangyari yun guys, when you have chemotherapy for patients with leukemia and lymphoma, pag nagbigay ka ng isang chemotherapeutic drug, ang expectation ay maraming mamamatay na cells. Your tumor cells will die, and of course, other ancillary cells that are normal and healthy. That is the adverse effect of giving chemotherapeutic drugs. So kapag nangyari yan, may mga lumalabas na electrolytes inside these cells, as we will discuss here. Okay. So ano ba yung mga components ng ating intracellular component? You have first potassium, uric acid coming from your purine metabolism, and phosphates as byproducts of your ATP hydrolysis. And as expected, you also have extracellular substances such as sodium, chloride, and calcium. So ang nangyari guys dito is, of course, expected na mataas ang ating uric acid. Tama, kasi you have uric acid found inside the cell. Kapag ang cell ay pumutok, lalabas ang uric acid in the process. Of course, tataas ang ating potassium kasi pumutok ang ating cells. You have high potassiums inside the cell. Okay? Now, what happens in your hyperphosphatemia and hypocalcemia? Bakit ka may ganyan? The calcium in the blood is actually stable in amount. Hindi naman siya nagbabago. Pero ang nagbabago ay the increase in your phosphate in the blood coming from the destruction of your tumor cells. So when that happens, kasi calcium and phosphate can form a complex together. So it means nauubos yung phosphate, nauubos ang calcium mo in the blood, leading to hypocalcemia. Pero dahil sobra-sobra ang phosphate mo na lumalabas from the destroyed cells, nagkakaroon ka ng hyperphosphatemia. So this is your tumor lysis syndrome. Now, in the clinics, guys, when there's a patient undergoing chemotherapy, you have to order this after a few days. So usually, pinapa-order mo phosphate, uric acid, potassium, and calcium. And you also add creatinine. Kasi tumor lysis syndrome can lead to urate nephropathy. Dahil sobrang taas ng uric acid mo, it can actually cause AKI. So you have to watch out for your kidney status after treating patients with lymphoma and leukemia. Okay? Right. Next question. Okay. Endocrinology naman tayo. All right. So most of you answered A, tachycardia. But the correct answer is guys actually C, hyperactivity. Guys, handaan lang po sa pagsagot parate ha. Take note of the terminologies here. Ano ba sabi ko dito? The most common symptom, not the most common sign. Alright? Guys, signs are objective findings. Yan ang nakikita ng doktor natin. Yan ang nakikita mo as a future doctor. While symptoms are the subjective findings, yan ang nararamdaman ng ating pasyente. So this is a very good table also found in your handout. In a different form lang siya. Pero as you can see guys, the symptoms here are decreasing in order frequency in the signs as well. So as you can see, hyperactivity is the most common symptom of thyrotoxicosis, while tachycardia is the most common sign. However, in the elderly population, atrial fibrillation is the most common sign. Okay, take note of this concept in thyrotoxicosis. Again, guys, huwag malito sa ating signs and symptoms. So in this case, a while ago, guys, malabo na po si tachycardia and atrial fibrillation kasi both of them are signs of thyrotoxicosis. There are not symptoms. So, guys, in testmanship-wise, it only leaves you with two na lang. Hyperactivity and heat intolerance. But in this case, the correct answer is hyperactivity. Okay, number 5. Okay, so most of you answered type 2 respiratory failure, and that is the correct answer. So we have to discuss and differentiate different 4 types of respiratory failure. Type 1, type 2, type 3, and type 4. So ang type 1, guys, is a problem of oxygen. And remember, guys, oxygen is the number 1 most important gas in the body. Therefore, oxygen-related problem is type 1 respiratory failure. So, anong nangyari dyan dito? Kapag meron kang edema, you have pneumonia, you have hemorrhage or ARDS, di ba? Nagkakaroon ka ng edema sa iyong pulmonary capillaries, okay? Doon sa ating mga alveolar component. So, when that happens, nagkakaroon ng problema in the passing of oxygen across the respiratory epithelium barrier. When that happens, bumababa ang ating oxygen levels in the blood. So it's a problem of type 1 respiratory failure kapag sobra-sobra na yung problema with these pathologies. Ang ating feature dyan is a less than 60 millimeters mercury. Okay? Pag type 2, think of the second most important gas in the body or carbon dioxide. So it's a problem of carbon dioxide retention. So tumataas ang carbon dioxide levels mo in the blood to more than 45 millimeters mercury. So paano nangyayari yan? Of course, in our case, it's a case of COPD. It's a form of obstructive pulmonary disease. Diba ang problema sa COPD is you have air trapping. So hindi mo nalalabas yung ating gas molecules from the lungs going to the environment. When that happens, ang nangyayari, CO2 is being retained in the body, causing an elevation of your PCO2. Ano pa? Problem in CNS drive. Example, ang pasyente ay nagka-trauma sa utak, for example. Dahil hindi siya makapag-modulate ng proper breathing process, ang nangyayari, nagre-retain ng ating carbon dioxide. Same in case of GBS, for example, Guillain-Barré syndrome. Okay, mahina yung respiratory muscles, hindi ka maka-properly breathe. Mababa ang iyong tidal, mababa ang iyong respiratory rate. So when that happens, you retain carbon dioxide inside the body. So you'll have an increase in PCO2. Now for type 3 and type 4, you're actually very unique. They depend on the setting of the patient. So kapag meron kang atelectasis or atelectasis in the perioperative period, for example, after mag-opera, di ba, nakahiga ka na matagal, so there is actually tension of mucus in the lungs. And of course, the anesthesia, pinapahina niya konti yung ating respiratory muscles. Because of that, nagkakaroon ka ng konting type 3 respiratory failure. Pag type 4 naman, it occurs in hypoperfusion occurring in shock. If you have shock, hindi po goal ng katawan mo na magdala ng blood sa iyong respiratory muscles. Ang goal niya ibigay sa ating heart, sa brain, saka sa ating kidneys and adrenals. Yun ang goal ng ating body in times of shock. So when that happens, nagkakaroon ka ng weakening of your respiratory muscles leading to type 4 respiratory failure. In our case, let's discuss them. Okay, mayroong COPD. So, isipin mo, baka may problema ka na with CO2 retention at the back of your head, right? So, tama yan. And take note of your ABG parameters. Look at oxygen and carbon dioxide. Oxygen is more than 80 milliliters mercury, so safe ka. Mula kang type 1. But look at PCO2, guys. Meron kang 50. Is more than 45. So therefore, you already have CO2 retention. So with this case, you have a type 2 respiratory failure. Okay, number 6, guys. Okay, a very testable question. Okay, so most of you answered A, doxycycline. C pala ang sagot nyo, penicillin G, and ang second naman ay A, doxycycline. So medyo half-half kayo ng konti. Now, this is a case of leptospirosis. Okay, guys, at the case natin, you have a wading in the flood water. So yeah, you have an idea na baka leptospirosis to. Initially, you have myalgia and arthralgia. These are signs of mild leptospirosis and fever. Kaso, kung papansinin mo, as the days progress, kasi akala niya influenza lang siya. Pero nangyari, nagkaroon siya ng jaundice, nagkaroon ka ng low urine output, and nagkaroon ka ng difficulty of breathing. Okay, so these are actually signs of severe leptospirosis. It's actually your Wales triad. So kapag severe na ang ating leptospirosis, the best treatment of choice is penicillin G. Pag mild ka lang, is doxycycline. Dok, bakit ka merong difficulty of breathing? At bakit siya part ng ating Wales syndrome? Kasi it's because of your hemorrhagic diathesis causing pulmonary hemorrhage in patients with severe leptospirosis. So jaundice, renal dysfunction, having low urine output, and having pulmonary hemorrhage due to hemorrhagic diathesis. So hindi lang difficulty of breathing yung pwede mo makita. You can have different rashes along the body na purpuric or even hematoma formation. So that is your Wales syndrome. Okay, may problema ka sa liver mo, sa coagulation mo, and sa iyong kidneys. That is because of your Leptospira interrogans. Now, ang kakaiba sa ating leptospirosis, uniquely, meron kang loss of magnesium in the urine. There is also a testable concept here. Okay? Ano pa yung mga infection na may kakaiba? involvement ng ating electrolytes. Hyponatremia for what? It's for your Legionella infections. Hyponatremia for Legionella, very prominent. And of course, hypomagnesemia is also very prominent naman in leptospirosis. Again, guys, kapag mild lang ating lepto, it's doxycycline. It's a first drug of choice. Pero kapag severe na siya or moderate, you must provide intravenous penicillin G. Both of them should be given for at least 7 days. Next question. Okay, let's check the poll kung kamusta yung mga question, sagot nyo dito so far. Okay. CKD problem, under nephrology naman tayo. All right. So most of you answered letter C, 30 ml meters per 1.73 meters square. That is the correct answer here. Okay. Guys, you have to recall CKD definition. It's very important as future practitioners as well. CKD is less than 60 ml per minute per 1.73 meters square, persisting for at least 3 months. So if nagbakuha ka ng creatinine recently lang, tapos nakita mo mataas siya, you have to have a data on the previous 3 months na creatinine mo. Para malaman mo if tumataas ba yung trend ng kanyang creatinine levels. Kasi if hindi naman talaga sobrang taas before, baka AKI yan. So have that at the back of your head. But, Doc, pwede ka ba magka-CKD pero yung eGFR is more than 60? Pwede po yan. As you can see here, guys, you have 2 parameters in CKD classification. One is eGFR, pangalawa is albuminuria. So if you have albuminuria and you have a pre-existing disease that can cause renal problem, baka may CKD ka na rin. It can be G1, G2, G3A, G3B, G4, and G5. And please take note of the values here, okay? Yung mga more than 2 or equal. Okay? Kasi what if tanong sa exam, the eGFR is 30. Okay, what is the classification? So as you can see, guys, sobrang nasa end of spectrum siya for G3B. So you have to at least know these values. Dali na yan, guys. 90, 60, 45, 30, 15. You only need to memorize these 5 values. Diyan na maglalaro yung ating categorization. Okay? And of course, if kahit wala kang albuminuria, pero as you can see in the ultrasound, parehong maliit ang iyong kidneys. So suspect for CKD already in this case. Okay? Kaya guys, when there's a new patient at the ER na walang history of creatinine, wala ka makitang any comparison, you may perform KB ultrasound. Kasi makita mo, if parehong small ang kanyang kidneys bilaterally, baka may CKD na pala siya. Hindi na po nagpapatingin sa pasyente as a doctor. Especially if the patient has diabetes, which is the leading cause of CKD worldwide. Okay guys, so leading cause for biggest cardiovascular disease, and take note of the stages. Okay, kasi matanong yan. May mga matanong dyan na mga parameters. Of course, anemia is normocytic normochromic and usually occurs at stage 3, but is only universal kapag stage 4 na ang ating CKD. And gadolinium at stage 3 is only minimized, pero should be totally avoided at stage 4 and stage 5. Kasi it can cause a disease known as systemic nephrogenic fibrosis. Okay, systemic nephrogenic fibrosis. Gadolinium can cause this condition and can cause systemic fibrosis all over the body. Kaya iniiwasan mo siya kasi it can cause parenchymal damage of your liver, the lungs, etc. Number 8. Kaya very favorite question. Okay, you have to know this. Autoantibodies in your SLE patients. Okay, bukang alam ng mga students ha. So the correct answer is A, anti-Rho. Actually guys, in this question, pwede ka na mag-add man out dito. Kasi you should know that anti-La and SSB are actually the same. Anti-La and SSB are actually the same. They're referring to one parameter. Ang anti-Rho, ang isang terminology niya ay SSA. Ang mnemonic ko dyan is ROSA. ROSA, anti-Rho is also your SSA. So anti-Rho is the correct answer here. So guys, let's have a review for different SLE on autoantibodies. Okay, mabilis lang guys yung mga pertinents dito. ANA is the best screening tool parate. That is our entry parameter for diagnosing SLE. Pag ang usapan ay specificity, anti-SM or anti-Smith is very specific but has no other correlations. Yun lang yung point niya. It's only specific. Anti-DS and DNA is all about activity. Okay, it's also specific pero ang point sa kanya is meron siyang correlation with disease activity. If mataas yan, baka you have to watch out for nephritis and vasculitis. Anti-ROSA. Okay? Siya yung ating Zika syndrome and siya rin yung merong predisposition to your subacute cutaneous lupus and neonatal lupus with congenital heart block. Kaya guys, in OB, okay, sa mga pasyente na may SLE, you have to test for anti-Rho kasi you have to foresee the possibility of having a congenital heart block in the infant of SLE patients. Anti-histone naman, okay, very favorite din to, drug-induced na SLE. You have to know that. And of course, you have to know the different components of your APS labs. Yung mga labs na pinapagawa mo to rule out your anti-phospholipid syndrome. Okay, your beta globin, okay, prothrombin, etc. So these are the important autoantibodies for your SLE. Okay? Next question. Okay, so the correct answer is A, and most of you got the correct answer, around 73%. So, ang sumunod sa sagot nyo ay B. So, this is a case of anaphylaxis. In the case, may 41-year-old female ka, nabiglang nahingal. Hingal na hingal siya at having urticaria in the skin. Tapos, nangyari siya pagkatapos sa kumain ng peanut butter. So, ang peanut kasi is actually a very strong allergen for most population worldwide. Sa mga pagkain, siya yung pinaka-top one, kumbaga. So, have that at the back of your head. You have a trigger. You have the onset of dyspnea and onset of skin lesions. Think of anaphylaxis already. Okay, so the best treatment here is IM epinephrine na binibigay at the supine position, not upright, not sitting position. Okay, it should be IM. So guys, for anaphylaxis, it's an interplay of different substances being secreted by your, sorry, minute text lang. Okay, sorry. So it's being mediated by the different substances being secreted by your mast cells. So one of them is histamine. Ang histamine kasi is a very strong vasodilator. So when that happens, nangyari, is nagkakaroon ka ng vasodilation of your different blood vessels. Can actually lead to hypertension afterwards and reactive tachycardia. Moreover, the histamine along with other metabolites can cause bronchoconstriction of your lungs. So with that said, you should have epinephrine. Kasi ang epinephrine mo is actually a very good medication for opening your different bronchioles in the lungs. So para magkaroon ka ng proper aeration. Okay, so ginagamit siya para magkaroon ka ng anti-wheezing factor to your lungs. So para magbigay siya properly, you have to give it at the supine position. Kasi once you give epinephrine to the patient, magkakaroon ka ng automatic na sorry, text sa akin. Okay. Magkakaroon ng automatic na vasodilation in your peripheral blood component. When that happens, magkakaroon ka ng poor venous return going to the heart. Okay? So kapag nangyari yan at nakatayo ka, malamang mahihirapan yung iyong circulatory system na magpadala ng blood going back to the heart. So magkakaroon ka ng tinatawag na empty ventricle syndrome. So to prevent your empty ventricle syndrome leading to poor cardiac output, mas maganda na ang pasyente ay naka-supine position. So kahit na mag-vasodilate ang iyong blood vessels peripherally, magkakaroon ka pa rin ng adequate na venous return going to the heart for proper functioning. So that's a very important factor na kailangan nyo matandaan, especially when you practice after the board exams. Okay? Number 10. So guys, ipapasin yung mga questions ko is actually clinically relevant. Kasi ang tingin ko sa inyo guys ay magiging doktor na kayo pagkatapos. So guys, konting thesis na lang, konting aral na lang ng konti, matapos din to. Okay? This is also important when you attend patients in the wards. So most of you answered A, schizophrenia, but the correct answer is actually dog delirium. Doc, bakit? It's about the type of hallucination. This should be delirium. Kasi pag schizophrenia ang iniisip mo, they are auditory hallucinations. Diba? In the psych wards, ang kwento, may bumubulong daw sa kanila. Kung may bumubulong sa kanila, think of an auditory hallucination here. So, the psychiatric illnesses, schizophrenia po yan. Kapag medical problem, it's usually a visual hallucination. For example, yung pasyente, tingin niya, mayroong light from afar, pero wala naman talaga. That's a form of visual hallucination. Tactile problem, ang problema nito usually, parang tingin ng pasyente, may mga gumagapang sa kanya ng mga parasites. Usually seen in cocaine use ng mga stimulants natin and during alcohol withdrawal syndromes. And lastly, we have olfactory and gustatory hallucination. Ito yung mga very prominent yan kapag magkakaroon ka na ng epileptic seizure. If you have a temporal lobe epilepsy or if you have a brain tumor in the temporal lobe. Ang nangyari dyan, before you have the episode, may naamoy ka na burning rubber in the environment. When that happens, ang mangyayari ay magkakaroon ka ng parang aura. Pero ang premonition na magkakaroon ka ng epileptic seizure afterwards. It's a form of hallucination. In contrast to your illusion, ang illusion mo, there is actually distortion or misinterpretation of a real external stimuli. For example, may dumaan na aso sa harapan mo, pero tingin mo sa kanya ay lizard or cat. Yan, that's a form of illusion. Ang hallucination, wala talagang stimuli dyan, pero tingin mo meron. Okay? So, yan ang ating mga different na hallucinations and they are very important in clinical practice. Okay? And guys, don't forget to study your neurology and psychiatry in IM kasi it's part of the questions in the board exams. Okay, sorry guys for the hassle kasi I'm on duty. Okay, so I should be working soon. So sorry for the technical difficulties and sa pagmamadali kanina. Alright, so I hope you learned something this morning. So good luck in the board exams.
Ayan, thank you, Doc Prince. Palakpakan naman natin si Doc Prince, no, kahit sa mga utak lang natin. Thank you so much, Doc Prince. Kaya mag-duty ka na. Maraming salamat. Ang score ko sa quiz mo, tumataginting na 2. So, patingin nga ako, guys. I-message nyo nga sa akin. I-PM nyo nga sa akin what your score is. Tingnan natin yung average nyo. Wow, naka-6. May 6. May 7. Kawawa naman ako 2. O, see, guys. Yung mga iniisip nyo na hindi kayo nag-aral, kung hindi kayo nag-aral or walang pumapasok sa utak nyo, hindi yun totoo. Kasi kung ako naka-2, kayo may 5, 6, o 8, alright? So I think our mean score is around 5 to 6. So kung mga naka-5 to 6 kayo, no, pwede na, pero mag-aral pa rin, no? We are doing IM for the next 2 to 3 days. Okay, so galingan nyo. Alright, so
thank you very much, Prince. Thank you very much, Nina. Okay, again, the target scores for the Quizmaster and practice test that you have is 6 or 60%.
6.
Okay,
Yes.
I would recommend that for your practice test, pag ginawa nyo siya, guys, i-apply nyo yung 12 rules of testmanship and proper test taking strategies. Mag-print talaga kayo ng Scantalon. Di ba meron tayong binibigay na Scantalon paper sa inyo for the diagnostic midterm finals? Print that and then apply yung tinuro namin sa inyo na answer first sa questionnaire and then yung answer dun sa Scantalon sheet. That will be your parang double checking, proofreading ng mga sagot nyo. Transfer 10 questions at a time, cover your choices. Apply the testmanship strategies that we've taught you. Okay? So print your Scantalon sheets when you answer your practice test. Thank you very much, Ninya.
Thank you so much. Thank you, guys.
Good luck,
Thank you sa
guys.
ating mga nanonood sa portal. Thank you, Doc Prince. Maraming salamat. So mag-aral na, mag-breakfast at kumain at mag-aral. Alright? Bye, everyone. See you soon.
Bye, guys. Good luck.
Bye.